stay-at-home order goes into effect today. Now, this is going to impact grocery stores. We have all the details that you need to know before you make your next grocery run.
Working on the front lines, we'll hear from a local nurse about how the coronavirus is impacting the mental health of our healthcare workers. Plus, should we be washing our produce with soap? We'll verify.
Cosmetologists are getting creative. They still want their clients to look good, but from a nice, safe social distance. We'll let you know how they're doing it. What's new starts now.
And now, live from WKYC Studios, this is What's New.
Hello again, everyone, and thank you so much for joining us. I hope you made the most of your weekend. Reporting from home, I'm Jay Crawford, Betsy Kling. Back at our studios, WKYC studios, holding down the fort. And Betsy, as we stand by, waiting for President Trump's daily coronavirus press briefing, if you would, please get us up to date on the coronavirus latest here in Ohio.
I can do that. Thanks, Jay. Well, this afternoon, Dr. Amy Acton shared new information about confirmed COVID-19 cases. There are now 4,450 cases in Ohio, 142 deaths. 371 have been admitted to the ICU. Overall, total hospitalizations have now reached over 1,200, and Dr. Acton announced 303 patients have been released, and 25% of those are recovering. She also praised everyone for doing the right thing and staying home.
People at home, you are moving mountains. You are saving lives. Again, I get emotional talking about this because this is no small thing that we are doing together. It is so incredibly hard to have shut down our lives the way we have. I am absolutely certain you will look back and know that you helped save each other.
Well, Governor DeWine said he's working with mobile food vendors to set up locations for truckers. The pandemic has caused some places to close, making it hard for truckers to find hot meals. And he's authorizing the National Guard to help at Elkton Federal Prison. 7 inmates have now tested positive, 3 have died, and there are many who are showing symptoms. The Guard's men and women will be in the hospital or will be providing medical care to the inmates for at least a week until more federal assistance arrives. And the Governor DeWine, of course, has his new stay-at-home order that takes effect today. 3 News' Laura Queso reminds us all what changes this includes.
There are new requirements for retailers. They must determine a maximum number of customers in the stores. Stores must post that number for customers. Weddings are permitted, but receptions must follow social distancing guidelines. Also, anyone entering the state of Ohio from out of state must quarantine for 14 days. That includes the many snowbirds returning north.
One of the concerns we have is that people coming into Ohio from other states will bring something in with them. And so that is why our order was issued the other day. But just as a very specific reminder to folks who are coming back from Florida, we want you to come back. We would say to family members who are welcoming their parents back or family members back, help them out.
And as for Ohio state parks, they are still open under that order. Now, coming up at 6, we have even more from the governor's daily press conference. That includes what's happening at state and federal prisons, plus the need for protective equipment. And one other thing you'll want to hear from Dr. Amy Acton, how she's saying Ohioans are doing. Laura Queso, 3 News.
All right, Laura, thank you very much. Now on to your feed at 5, and as Laura mentioned, the new stay-at-home order begins today, and this one comes with new restrictions as to how many people are allowed inside stores at one time. 3 News reporter Rachel Polanski is outside a Heinen's in Shaker Heights. Rachel, what changes are grocers making?
Hey Jay, well, these new rules apply to all stores that fall under that essential business category. But it seems like grocery stores were the primary focus of Governor DeWine's orders after so many people reported that others weren't following social distancing guidelines. These stores will now be required to limit the number of people inside at one time. Now, the actual number permitted will depend on the store's square footage and daily foot traffic. Inside Northeast Ohio, Heinen's, Giant Eagles, Costco's, Sam's, Lowe's, and Home Depot's today, our 3 news crews did not spot any long lines. We did see posted signs and floor markings encouraging the practice of social distancing. Plexiglass dividers at most registers, and a lot of workers and customers wearing masks and gloves.
It was quiet. Everyone is like tending to themselves. Everyone's had their face masks on, they had their gloves on.
I didn't like the fact that the workers did not have on masks or gloves, but now they do, so I see some differences. And we need to take this serious because it is.
The governor said some stores are also working on implementing one-way aisles to lessen that physical proximity between shoppers, though I did not see that at any stores locally. Jay?
All right, Rachel, thank you very much. Innovative idea by the governor. Well, we have a couple of Google-related stories here that I think you'll find interesting. Google Maps now has a feature allowing you with the touch of a button to find out which restaurants near you have takeout and delivery options. And I know this is exactly what so many of you have been looking for. All you do is you go to Google Maps, and once you get there, you'll find a takeout button or a delivery button in the upper left-hand corner. Just tap the one you want, and all of the options will pop up on your screen. I actually tried it earlier today. It works great. I hope you find it as helpful as I did. It also is a great way to support local businesses during the outbreak. And this is a fascinating story. According to an op-ed piece in today's New York Times, Google's search content may actually help scientists map where the next coronavirus hotspot will be. Data scientist Seth Stevens-Davidowitz writes, searches for "I can't smell" increased in states like Louisiana and New York last week. Those, of course, are 2 of the possible symptoms to the coronavirus, and those are the 2 hardest hit states here in the United States. Davidowitz writes that currently in Ecuador, searches for "I can't smell" are up dramatically, indicating that that might actually be the next hotspot. Very interesting.
So mentally it's draining, especially when some of the things that we used to do outside of work to help with, help calm us down, mentally get us together, we're not able to do it.
Well, today's 2 o'clock update from the state of Ohio, about 20% of the positive coronavirus cases here in the state are healthcare workers. Our doctors and nurses are on the front lines helping take care of patients every single day. All of them going to work each day, putting themselves and their families at risk to help take care of those who've been sickened by the virus. Putting yourself in harm's way every day can take a toll on your mental health. A lot of anxious and fearful moments, and especially looking forward to how bad the surge will get at its peak. Fortunately, Cleveland's healthcare systems have solutions to help workers cope with added stress.
We're listening to them and understanding what are their concerns, what are their fears, and looking for creative ways to support them. So we have to take care of our medical staff and ensure that they are at their best so they can provide the best care to our patients.
Well, Metro Health is increasing the number of telehealth sessions available to caregivers to support them through the pandemic. Cleveland Clinic and university hospitals also have special phone numbers that healthcare workers can call for emotional support. And hopefully those folks will not be afraid to use them. Well, more confusion and now bigger problems regarding the anti-malaria drug hydroxychloroquine. There have been claims made that it's a treatment for COVID-19, but not everybody is on board with that idea. Now, India, the country, has reportedly banned half of the U.S. supply of hydroxychloroquine. And now, senior health correspondent Monica Robbins talked to an expert, and she'll break down what we need to remember.
Hydroxychloroquine, or HCQ, is a legitimately prescribed drug for autoimmune disorders such as lupus or rheumatoid arthritis. But now, thanks to India's ban and what those in the scientific community think is a premature belief that it is the miracle cure for COVID patients, those who truly need it, where it has been scientifically proven to work, may now be facing a shortage. Dr. Ryan Marino is a toxicologist and emergency doctor at university hospitals. He has been very vocal about putting the brakes on the thinking that HCQ is the miracle drug for COVID-19 without proper scientific evidence.
This kind of unethical human experimentation, in my opinion, and the way we do research and conduct studies and kind of gather evidence has evolved over decades and centuries for very good reason, because of kind of unethical experimentation on humans. And it seems very hopeful to kind of use these sick people, a last resort. Any benefit can be attributed to the drug is what people are going to believe, but there's also a good chance that we could be harming these people even worse. And there's no way to say that without getting better evidence first.
Dr. Marino says HCQ, even in a small amount, can cause serious heart problems, including stopping the heart. When people are prescribed this drug, they go through baseline tests to make sure they're not at risk of dying from taking it. But he says that's likely not happening with COVID-19 patients. And he's hearing reports out of France of cases of cardiotoxicity, which is another reason he says these clinical trials are so critically important. Now, HCQ in combination with an antibiotic is being clinically studied here in the U.S. And yes, in some cases, it's also being used in compassionate care when no other options are available. But it's always wise to let the experts make those decisions when appropriate. Monica Robbins, 3 News.
All right, now let's check in with Russ Mitchell for a look at what's happening in some of the other stories today. You know, out of all of this, one of the big things that we can take away is that there's a lot of people reaching out to help other people in this whole situation.
Exactly. We've got some more good news in that as well, Betsy. Good afternoon, everybody. We now know the next date for food distribution from the Cleveland Food Bank. It is this Thursday afternoon, once again at the Muni Lot. This time, the food bank is doing things a bit differently. They're asking you calling ahead and pre-register. They want you to call the help center at 216-738-2067, at least a day before you arrive. Again, that number is 216-738-2067. During this pandemic, many companies are being called on to clean and sanitize. Today we watched as High Rock Pest Control and Sanitizing gave the Cleveland Heights Police Station a deep clean after an officer there tested positive for coronavirus. The company did this free of charge. And it's the Easter tradition, Jelly Beanville in Euclid. But this year, because of social distancing, this will be a drive-by only display, no getting out of your cars. Even the Easter Bunny is staying away this year. And Betsy, I always thought the Easter Bunny, that was an essential business, but I guess not.
I saw the Easter Bunny riding around in a convertible on Saturday.
You did?
That was kind of fun. And by the way, I got your masks done.
Ah.
Men's wear masks, very fashionable.
Thank you
These
very
are not
much.
N95.
Okay.
But they do have the little metal clips, so here you go. I'll get those over to you.
I appreciate you, Betsy.
Toss them through the newsroom.
Thank you.
All right, thank you. Well, a lot of people are passing time at home by making masks or binge watching shows. And now there's a new platform that's come into the mix. Today, Quibi launched. Our digital anchor Stephanie Haney joins me now to explain what it is and how it works. I've seen a lot of Hollywood people talking about Quibi.
Oh, it's a very big deal, Betsy, and a lot of them are on the platform. So Quibi is all original content, and it's meant to be consumed on your phone or on your tablet, basically while you're on the go, not necessarily locked in front of a TV screen or a laptop. And all of the content is 10 minutes or less, which brings me to the name for the platform. It's a combination of the 2 words quick and bites. They've got scripted shows, news, reality TV like Chrissy Teigen in Chrissy's Court, and they even have the documentary series on LeBron James's I Promise School in Akron. Here's a clip from that.
I'm gonna be a police officer, I'm gonna be a nurse. I wanna be a scientist, an actress. Just kinda do my thing. Teachers told me that I wouldn't be able to make it.
When you grow up in the inner city and the projects, no one cares about you.
I don't feel safe in the neighborhood.
We have an obligation as a country to help those students.
Welcome to your first day at the I Promise School.
I was happy that LeBron James picked me.
Now this is executive produced by James. The series will make you feel sad, it'll make you feel inspired, it'll make you think about things. It's a total of 15 of these short episodes long, with 3 of them out right now, and the rest will be rolled out over the next couple of weeks. The best thing about this right now, Betsy, is that it's free for 90 days, which is perfect. We all need that right now. Then after that, it'll be $4.99 a month with ads, or you can upgrade $7.99 a month with no ads. And there's one more local tie. There's an actor named David Lewis who is a Cleveland native, and he is a star in one of the shows on Quibi, When the Streetlights Go On.
And they're 10 minutes or less.
Yep.
Very interesting. All right. Thank you so much, Stephanie. Well, coming up new at 5 as we wait for President Trump to have his address, we're going to be in desperate need of a haircut and color soon, y'all. How some cosmetologists are getting creative to keep their clients looking good. And a lot of you have been asking how to make your own mask at home. Our Stephanie Haney has an idea how you can do it, and you don't even have to have a sewing machine. And our Jason Fraser is filling in for Matt tonight. Jason, how's the forecast looking?
Hey there, Betsy. Yeah, so today was an absolutely wonderful day across Northeast Ohio, but I am tracking some rain showers that could also give us some rumbles of thunder. I'm going to let you know when that's going to happen when What's New comes right back.
Welcome back to What's New. It's been a few weeks now since the governor ordered closed all hair salons and nail shops and left those working in the industry worried about their financial futures. But as Tiffany Tarpley tells us, some have found creative ways to bring in whatever income they can.
Let's face it, we all feel better after leaving the salon or barber shop with a fresh haircut and style.
We are more than just hairstylists. I've had people, women, sit in my chair and cry. I cry with them. Just don't forget about that relationship because they're hurting right now.
Donella Jefferson has been a licensed cosmetologist for 19 years, now focusing on natural hair. She styled mine. The industry is hurting after Governor Mike DeWine's directive that went into effect about 2.5 weeks ago.
We're asking, and we will be ordering at the close of business today, that all barbershops, hairdressers, nail salons, spas be closed.
Despite the uncertainty,
few sleepless nights, some sleepless nights just trying to, process how this really is going to affect long term.
Donella says she was actually relieved for the shutdown order because of concerns over the virus spreading in her shop.
Hey guys, It's me again.
She's done video tutorials, and now she's taking that to the next level.
I was getting messages, can you do one on braids? Can you do one on twists? And so I decided to offer virtual appointments.
Yes, virtual hair appointments.
You really just came out of a style and you can't get a comb through.
At about half the price of what she charged for an in-person service. Not only bringing in income, but keeping herself motivated, engaged, and creative while assisting her clients. Now, she's also encouraging those clients to find ways to lift their spirits right now.
Even though we're sitting in the house, pick yourself up by putting yourself together, whether that's putting on some lipstick or doing a beautiful head wrap or just something to make yourself feel better.
Tiffany Tarpley, 3 News.
All right, Tiffany, thank you very much. Here's something you can do, too, if you want to help your local hairstylist, the one that does your hair. You can actually pay them now for a future appointment. That might help them make ends meet between now and then. Well, it was gorgeous outside today, and for that, I want to thank Jason Fraser, who's coming to us from his home today. The deal is, Jason, you get double thanks if you can keep this sun in the forecast for a couple more days. Can you do that?
Oh, you know what, Jay? I really wish I could, but unfortunately, I do have some bad news for you. We are going to get some rain as well as some rumbles of thunder. But you know what? Speaking of the sunshine, you know, today we're going to have a much later sunset. Sunset is scheduled for today at right around 8 o'clock, a few minutes right before 8 o'clock. And as you take a look at this graphic, you can actually see the closer it gets to summer, the more sunlight we are actually getting. All right, take a live look right now at Doppler Radar, and you can see all across Northeast Ohio, we pretty much have clear skies across the region, but that is slowly going to be changing over the next couple of hours. You can see right there over Chicago, we have our next weather maker that is slowly going to be moving across our area over the next couple of hours. But in the meantime, though, we do have temps right now that are sitting very mild. We're talking about 59 down in Medina, 61 in Worcester, and good evening to you in Mansfield. You guys are checking in at 64 degrees. National Design Mart hour-by-hour forecast. So the sunlight is going to slowly come to an end right around 8 o'clock, and then we'll see increasing cloudiness throughout tonight. Those of you south of downtown Cleveland will end up seeing a shower before those of us in downtown Cleveland will. And then look what happens by about 9 a.m. tomorrow morning. We get those rumbles of thunder that are going to be moving through. Then we're going to see some peaks of sunshine and some scattered showers throughout the day. And look at what happens after that. We're talking about temperatures well into the upper 60s. Some of us may even hit 70 degrees. The farther inland you are, the more likely that you will likely end up seeing those much more mild temperatures. And then tomorrow night into Wednesday, that's when we'll get another round of some showers. Here's a look right now at your Universal Windows Direct 7-day forecast. But one of the things I do want to talk about before we do that is tomorrow's get out the door forecast. You're definitely going to want to make sure that you have the umbrella tomorrow. All right, so as we take a look at the 7-day forecast, so by Wednesday, we'll see a high of 64 degrees, and then a cold front comes through, and then we're talking about temperatures in the 40s. So, Betsy, we have not said goodbye to the cooler temperatures just yet. Urgh.
I didn't think we would, but you know, I'm ready for 60s every day whenever you can order that up. Jason, thanks. Clicking in Cleveland is next. Stephanie's going to show us how we can make masks that don't involve a sewing machine. Stay with us.
Well, it's time now to see what's been clicking in Cleveland through the day today. Stephanie, I'm looking forward to your nifty no-sew mask, but you've got some other things that you're talking about today.
I do, Betsy. Yes, that's coming right up. But first, we've all seen that gas prices have been down, which to a lot of us we're maybe not paying attention to because we're not really supposed to be going anywhere. But essential workers still have to get to work. And now BP and Amoco are offering them an extra discount. They are offering them 50 cents off per gallon. This is to first responders and healthcare workers for their next fill up. So what you have to do is verify your status as one of those employees online through ID.me, and you'll get a discount code to use for the next time you stop for gas at a BP or an Amoco, and that's good now through April 30th. Now for the rest of us, the CDC is recommending that when we have to go out in public, we do wear a cloth mask, but not everybody has a sewing machine. So I found this hack where you can make your own mask without using a sewing machine with some things that you probably already have around the house. It just requires a bandana and 2 hair ties. And this is all you have to do. Open up your bandana. You're going to want to fold it in. This is the part that's going to cover from your nose to your mouth. And you take your hair ties. Slide them on the ends. And then fold these over. This is the part that's going to go around your ears. You can tuck this flap inside this other one. This is the part that's going to go around your other ear. Now you've got your mask. That's it, it's that simple. So here's my mask. I'm just going to slide it around my ear. Slide it around this side.
Looks awesome.
There you go. It's that easy. Now remember, the smaller hair ties work better, but the full video is up online if you want to watch that back, if you want to make one at home.
Right? I think it's a great idea. A lot of people have that lying around. You can cut up a t-shirt or some kind of an old shirt and do it all the same. So thanks so much, Stephanie. Appreciate that. That's cute. And remember, we're not looking for N95, folks. You're not going to wear this in surgery or anything. It's just to get you through your day. Appreciate it. We'll be right back.
And now, live from WKYC Studios, this is What's New.
All right, everybody, it is Monday, but it's almost over. That's the good news. We hope you've had a great day. We got to see that sunshine today. That certainly helps everybody out a little bit. I'm Betsy Kling, and my co-host Jay Crawford is working from home. And Jay, you got a story about a Brunswick family who's getting creative to throw a baby shower.
Yeah, it's a great idea. I only wish I would have thought of this before we canceled my daughter Kirsten's baby shower, because it's a great idea and gives you a chance to have a little fun, too. Danielle and Dan Procorny are expecting a baby girl in May. They tried for years, finally got pregnant through IVF, but their shower was canceled this past weekend, obviously because of the coronavirus. But friends and family jumped in, they got creative, and they put into action a plan that had a drive-through shower. They drove by honking and waving, and they also left gifts on a table at the end of the yard and cheering on the parents-to-be. Not quite the same, but still, Betsy, a really cool idea. And it beats just canceling the shower altogether, which is what we did.
It totally does. Everybody stayed far enough apart. They got to see each other, which is such a big deal. I got to see my parents over the weekend. We kind of took a walk like far apart from each other, but it was just so good to see them in the flesh. So thank you. That was really good news. We like that. Well, let's get everybody caught up on the latest on the coronavirus. This afternoon, Dr. Amy Acton shared new information about confirmed COVID-19 cases here in Ohio. There are now 4,450 confirmed cases, 142 deaths. Overall, 371 have been admitted to ICU. She also said 25% are now documented to be in recovery. So this is definitely a positive sign. Giant Eagle is among the latest stores to limit customers. The company says it will start restricting customers to half of the occupancy allowed by fire code. And the Surgeon General predicted this may be the worst week of some people's lives as coronavirus peaks in other parts of the country. But Dr. Acton says she doesn't think this is our peak week here in Ohio. She says we'll be a bit further out, probably 2, maybe 3 weeks out from that, thanks to our social distancing that we've all been practicing. Well, it's time now for our top talker. There have been a few reports of pets being tested for coronavirus, and actually, they were positive tests. Yesterday, a tiger at the Bronx Zoo was confirmed to have it. Our Romney Smith has been looking into this, and she has more.
So a big question everyone has is, how did the zoo staff even suspect the coronavirus when experts have told us not to worry about animals? This is 4-year-old Nadia. She's the Malayan tiger diagnosed with the coronavirus. Nadia, 3 other tigers, and 3 lions all developed a dry cough and their appetites decreased. Because Nadia was impacted the most, she was tested first.
She was test positive. And it surprised everyone because that hadn't been documented before. And it actually was really reassuring how well the city, state, and federal agency, human health, and animal health agencies all work together on this.
I spoke with both the Cleveland and Akron zoos about their animals' health, as well as what it could mean for domesticated cats as well. Back to you.
All right, Romney, very interesting. Okay, let's get you caught up to date now on some of the other headlines that are making news right now. For that, we go back to the KYC studios and Russ Mitchell. And Russ, first, haven't seen you in a while, my friend. I got to check in. How are you doing?
I am doing just fine, partner. How you doing?
Hanging in there. Hanging in there. I miss seeing you every day, but that'll happen. That'll come soon.
I got you. Miss seeing you as well. But hopefully we'll see each other soon. How's that?
I like that idea.
All right, my friend. Let's begin with British Prime Minister Boris Johnson, who is in the intensive care unit of a London hospital after his coronavirus symptoms worsened. Johnson's office says he was taken to the hospital yesterday because of a persistent high fever. While Johnson is said to be conscious, he has asked his foreign minister to take over his duties. Actress Lee Fierro, best known for her role in the big movie Jaws, died yesterday of complications from the coronavirus. The actress who played Mrs. Kinter in the movie was living in Northeast Ohio, I say, in Aurora, at an assisted living facility. She was part of that iconic scene where she slapped Chief Brody. Lee Fierro was 91 years old. Today, East Cleveland school families picked up personal hygiene kits thanks to a $15,000 donation by Jarvis Landry of the Cleveland Browns and Meyer grocery stores. It is estimated more than 1,300 families received those kits. And that is all at 5:30. Jay, I will see you back here at 6 o'clock.
All right, very good, Russ. We'll see you soon. Live shows from home. We're not the only ones doing that. And getting better from the coronavirus. Stephanie Haney is back now. She has all of that in today's Pop Break.
The Ellen DeGeneres Show is back today, and her first guests for the at-home version are Chrissy Teigen and John Legend, who are opening up to Ellen about the realities of spending so much time at home.
I mean, I have, for some reason, more energy than ever for my kids and our family because you have no choice.
They're home.
You're stuck.
When this is over, the couple say they hope people have a newfound love and respect for each other. Author J.K. Rowling says she's feeling great and completely recovered after having coronavirus symptoms. She was never tested for COVID-19, but shared a doctor's advice on a breathing technique that really helped her when she was feeling her worst.
So, 2 cycles of deep breaths, hold your breath for 5 seconds, breathe out. 6th breath on each cycle, you will do a big cough to open up the lower airways.
Rowling says she wanted to get the word out because the exercise helped her and she thinks it could help others. And on John Krasinski's new digital show, Some Good News, he gave a 9-year-old girl named Aubrey the surprise of a lifetime after she was feeling down over missing the Hamilton tour, which of course was canceled due to the coronavirus.
When it's all over, I will fly you and your mom to New York and you will see Hamilton on Broadway. How does that sound? Boosh. Yeah.
And the surprises didn't end there. Aubrey is also a fan of Mary Poppins Returns. So next, Krasinski brings in Mary Poppins herself, aka his wife, Emily Blunt. And then Hamilton star Lin-Manuel Miranda popped up to surprise Aubrey before she was serenaded by him and the full cast.
Just you Alexander Hamilton, we are waiting in the wings for you.
What a performance. And I will tell you what, John Krasinski is really living up to his show's name. That is some really good news for that little girl, Aubrey. And can you believe this, Jay? She has never seen The Office.
I can't believe that. And she's a huge John. Listen, while we're on that note, I want to thank John for his genius acting in the greatest TV show ever made, The Office. Obviously, we've had a lot of time on our hands, so I've reacquainted myself with some old episodes, rewatching The Office past couple of weeks. And I have to tell you, Steph, that show more than any other, they hold up. I laughed just as hard watching it the second time and third time as I did when I watched it the first time. It's been a nice little diversion, a good way to laugh through the last couple of weeks for me. So, John, thank you on behalf of me and all the other Office fans out there. Steph, we'll see you again soon. Next on What's New, if you've had a birthday in the last month or so, you probably know that it's just not the same celebrating it. However, friends and family of an 8-year-old boy made sure that his birthday was still very special in the midst of this pandemic. We'll have that story. And Jason, how's the weather looking?
Hey there, Jay. Well, we saw clear skies today, and that is going to all change literally in a couple of hours. I'm tracking some rain showers that are also going to bring some rumbles of thunder. It's all coming up when we return.
All right, we're going to send it out to Jason. As we're waiting on the president, we have received the 2-minute warning, which oftentimes means we are on standby. So, Jason, we're going to try and get as much weather info in as we can before the president begins.
All right, let's do it. So outside your window right now, many of you are seeing clear skies. And as you take a look right now at the radar, you can see that this is pretty much the story across much of northeast Ohio, and a much wider view on satellite and radar. You can see that there is another system that we are looking at that's over Chicago right now, and that is what is going to end up moving in our direction. We're going to have much more on weather coming up for you in just a little bit.
That's right. President Trump is now addressing the nation from the White House.
To defeat the virus, as we enter a crucial and difficult phase of the battle, we continue to send our prayers to the people of New York and New Jersey and to our whole country. But right now, New York and New Jersey are very hot zones, and we're with them, we're with everybody. Your struggle is our struggle, and we will beat this virus. We will beat it together. I also want to send best wishes to a very good friend of mine and a friend to our nation, Prime Minister Boris Johnson. We're very saddened to hear that he was taken into intensive care this afternoon, a little while ago. And Americans are all praying for his recovery. He's been a really good friend. He's been really something very special, strong, resolute, doesn't quit, doesn't give up. We have made tremendous progress on therapeutics. I had a fantastic call today, which I'll be talking about a little bit later. And I've asked two of the leading companies, these are brilliant companies, Ebola, AIDS, others, they've come with the solutions and just have done incredible jobs. And I've asked them to contact London immediately. They have offices in London, the major companies, but more than major, more than size, they're genius. And I had a talk with 4 of them today, and they speak a language that most people don't even understand. But I understand something, that they've really advanced therapeutics and therapeutically, and they have arrived in London already. Their London office has whatever they need, and we'll see if we can be of help. We've contacted all of Boris's doctors, and we'll see what is going to take place, but they are ready to go. But when you get brought into intensive care, that gets very, very serious with this particular disease. So the two companies are there, and with what they are talking about, and it's rather complex and has had really incredible results. We're working with the FDA and everybody else, but we are working with London with respect to Boris Johnson. Across the country, we're attacking the enemy on all fronts, including medical, scientific, social, logistical, and economic. We're pressing into action the full power of American government and American enterprise, and our military has been incredible. We've just sent 3,000 public health personnel. They're now deployed in the New York area, and they'll be over at the Javits Center, over at the Great Ship. And as you probably have heard, and I was informed that Governor Cuomo has already told you and announced, he called me up a little while ago and he asked whether or not it would be possible to use the ship with respect to fighting the virus. And we hadn't had that in mind at all, but we're going to let him do it, and we're also going to let New Jersey, Governor Murphy, we spoke with him a little while ago, and New Jersey is going to use it also because New Jersey is a hot spot. So Governor Murphy and Governor Cuomo are going to be using the ship, New York, New Jersey, and it's a big ship. And it's now COVID, it's set for COVID, and we are going to, hopefully that will be very helpful to both states. The Javits Center, which is 2,900 beds, just built by our military, also is going to be manned now by the military, and they should be in place tomorrow. And they'll start sending quite a few people over to the Javits Center. It's convenient, it's right in the middle of everything. So that'll be something great, and we appreciated Governor Cuomo's really nice statements, and likewise Governor Murphy. We have worked very well with both of them and with, frankly, all of the governors. Vice President Pence had a call this morning with them that lasted for close to 2 hours. And I understand there wasn't a negative person on the call. 50 governors, or just about 50 governors. I think they were all on, from what I understood. And they were very positive about everything their federal government has been doing for them. And you'll hear what that is, and it's rather amazing, actually. Nationwide, the Army Corps of Engineers is building 22 field hospitals. These are big hospitals, and alternate care sites in 18 states. So you have a combination of 22 field hospitals. In addition to that, we're building alternate care sites, which is a little bit of a smaller version of the hospital. And we have a lot of them, and they're going up in 18 different states. In total, we have deployed 8,450 hospital beds from federal stockpiles. And, if you think this is done over a period of weeks, it's incredible, actually. More than 8,000 ventilators have been sent from the national stockpile to our cities and states, backed by the Defense Production Act, which we've used very strongly, very powerfully. So powerfully that we don't have to use it too much, frankly, and it's nice when you don't have to. We're getting more than we ever bargained for. American industry is stepping up. Manufacturers are really going to town, and we have thousands of ventilators being built as we speak, and we have hundreds that are being sent to different locations, and we're ready to roll with almost 10,000 that we have in the federal stockpile. When I say ready to roll, too, I mean exactly what that states. We are, wherever that monster goes, we're able to move with it. Great flexibility. We have tremendous flexibility, and we have people waiting, and they're ready, willing, and able, but waiting to bring them wherever it may be, if they're needed. If they're needed. It's possible that they won't be needed, that we're fully stocked, because numbers are coming in where, because of what the American people are doing, we're having fewer hospital visits. I think that could be the case in New York. It could be the case in a few other states. And fewer beds, fewer hospital visits mean fewer ventilators. So we'll see whether or not our original projections were right. But anyway, I had a very good talk with both governors, and I think they're very happy, extremely happy about what we're doing for them, and especially going all COVID. So that'll take place almost immediately. FEMA and HHS have directly distributed 11.7 million N95 respirators. Think of that. Get the number. 11.7 million N95 respirators. 11.7 million. 26.5 million surgical masks. 5.3 million face shields. 4.4 million surgical gowns, and 22.6 million gloves. 22.6 million gloves. We have also arranged for vast quantities of additional materials to be allocated through donations and existing supply chains. We've also given tremendous medical material and supplies throughout the 50 states and territories. And through Project Airbridge, we have succeeded in bringing plane loads of vital supplies into the United States from overseas. We had an additional 3. These are massive planes, by the way. The big planes are very big, very powerful, and they're loaded to the gills with supplies. And rather than bringing them into our stockpile, as we've discussed, we bring them to all the different locations where they're needed, so we can save a big step and a timely step. Because of my actions under the DPA, I can also announce today that we have reached an agreement, very amicable agreement, with 3M for the delivery of an additional 55.5 million high-quality face masks each month, so that we're going to be getting, over the next couple of months, 166.5 million masks for our frontline healthcare workers, So the 3M saga ends very happily. We're very proud to be dealing now with 3M and its CEO, Mike Roman. I just spoke with him and I thanked him for getting it done. And Mike was very happy to get it done. Great company. So we're getting 166.5 million masks, and mostly that's going to be for our frontline healthcare workers. Okay, that's 3M. Thank you, 3M. I also want to thank Apple, one of the many great American companies that's really leapt into action. Today, Apple announced that it is now producing plastic face shields for healthcare workers at the rate of 1 million per week. 1 million, and these are the shields that you see on television quite a bit, and they're at the highest level of quality and safety. We're grateful as well to Salesforce, which has donated 48 million pieces of personal protective equipment, including masks, gowns, suits, and face shields. So thank you very much to Salesforce. I urge all of our nation's governors to ensure that the massive deliveries that we've made to your states over the past few weeks are distributed as quickly as possible. So again, we're working very well with the governors. Now, they may see you and say, oh, we're not happy, but they're very happy on the phone. And Mike Pence is a straight shooter, and he had a great phone conversation to them with all of the governors, teleconference. And they're very happy, every one of them. Were there any negatives?
No, sir.
See? I told you. Mike is the greatest. Mike, and you have done a great job, Mike, and I appreciate it. The whole country appreciates it.
Thank you, Mr. President.
Anthony appreciates it, right? Don't you see? Everybody appreciates Mike, special man. So a lot of the things that we've done, again, are going directly to the states. The states seem to be very happy. If they're not, they can call me directly. They can call Mike directly, and we'll make them happy. But tremendous progress has been made in a very short period. And I think very importantly, the progress has been made before the surge comes, because the next week and a half is going to be a big surge, the professionals tell us. And I think we're in good shape for it, Anthony. So it's good timing, really good timing. We can have this stuff there. It's already there for the most part, but we're bringing a lot of different resources to the various locations, especially where the surge is looking like it's going to take place. Resources from the national stockpile need to reach our warriors, and they are warriors. I tell it all the time. I saw it again this morning. He's young, in many cases older, but they're walking into the hospital and they're putting on, I mean, as their doors open, they're going into this place, and, you know, it's not exactly too safe. And they're going in there and they're putting the outfits on and they're putting their masks on, and it's incredible. It's like no different than you watch the war movies or you watch the old clips of war running up hills. To me, it's the same thing. Men and women, young and old, but a lot of young people just going in there. They're not thinking about, oh, gee, this is dangerous. They're not saying, oh, I don't want to go in. They're warriors. They're running through those doors. It's the most incredible thing. It's an incredible, beautiful thing. Resources from the national stockpile need to reach these warriors in the hospitals immediately, and we're making sure they do. And again, the states have that responsibility, but we're working with the states, and we're getting the states a lot of things that they can distribute, or when they tell us, we bring it directly to the hospital from the federal stockpile or from the planes that land, without even going to the stockpile. If any state's having difficulty distributing supplies, we urge you to use the National Guard to assist in the delivery. And I have to say, you have done a fantastic job. Deborah, you know that you've done great. Tony, you know that you've done great, but what a job you've done, and I appreciate it. I really do. Your whole group has been incredible. That's a lot of stars you have, I'll tell you that. He's supposed to do a great job when you have 4 stars, right? But the military has been incredible, and I thank them for all of us. Conversely, if a state believes that it has surplus equipment or supplies, very important, because we actually have gotten so much to some of the states that they're able to now, they've done a fantastic job, and they've kept that line low. And we have some states that have surplus equipment and supplies, and they're working with us to rapidly redeploy those supplies to areas of greatest need. We thought that might happen. If it worked out well, that's what was going to happen, and it's happening. And I want to thank Governor Gavin Newsom, who's doing a tremendous job, who's announced California will send 500 ventilators to be distributed to other locations. I think some are going to Arizona, some are going to Washington, D.C. We think they're going to Delaware. We're working to that, but 500 excess ventilators from the state of California, and we're going to get them taken care of wherever they have to go. Those decisions are being made right now. The members of the White House Task Force and I are in close touch with mayors and governors and hospital administrators across our country, and we're told that at the present time, most of the critical needs are being more than met. States have to continue sharing detailed information in the amount and utilization rates of medical supplies so we know what to resupply them, or they can get it directly. That includes ventilators. They can get it directly. Ideally, if they can get it directly, but if they can't, if they're unable to do it, we have tremendous amounts of supplies, and we're building it up very fast, too. And this is before the big surge. This information is fundamental to our ability to deliver the material when and where it's most needed. Now, Mike, in his conversation today, I think got some information as to a couple of locations where we're going to be delivering large numbers of ventilators and large numbers of medical supplies, and we'll take care of that. But some of the states are very happy. Even Governor Pritzker from Illinois is happy. Of course, he may not be happy when he talks to the press, but he's happy. He's a very happy man. We're increasingly hopeful that the aggressive mitigation strategy we put into place will ultimately allow our hospital system to successfully manage the major influx of cases that we have right now. Again, I say that we're finding, because of the incredible job done by the American people in conjunction with everybody, governors, the military, federal government, state government, local government. I've had a lot of conversations with New York City and Mayor de Blasio. I've gotten to know him. I didn't know him. Gotten to know him. And a lot of people are working hard. Everybody's working hard. A lot of people are doing a great job. I'll tell you that. A lot of people are doing a great job. But the goal is that all Americans have been sacrificing to achieve these last few weeks, things that a lot of people thought were not possible to achieve. And I think we've more than achieved, but we have to go through. Again, we're going to have a rough week. We're going to have maybe a little more than a week. But there's tremendous light at the end of that tunnel. I said it last time, said it last night. There's tremendous light at the end of the tunnel. There's so many things happening with therapeutics, with vaccines, with things that we really want. Deborah, Tony, they're all working so hard on this, but those therapeutics, I mean, look, the vaccines are going to be always a little bit later because of that testing period, but the therapeutics, getting the kind of things that I heard about today, talking to these brilliant companies and brilliant people on the phone was fantastic. It was such an incredible conversation. And I also spoke just a few minutes ago with former Vice President Biden, who called, and we had a really wonderful, warm conversation. It was a very nice conversation. We talked about pretty much this. This is what we talked about. This is what everyone's talking about. This is what they want to talk about. And he gave me his point of view, and I fully understood that. And we just had a very friendly conversation. Lasted probably 15 minutes. And it was really good. It was really good. Really nice. I think it was very much so. I appreciate his calling. As we continue our efforts to develop treatments and cures this afternoon, I spoke with leaders of the American pharmaceutical companies, and just to give you their names, Amgen, Genentech, Gilead, Regeneron. These are four of the greatest in the world for doing exactly what they're doing. And Currently, 10 different therapeutic agents are in active trials, and some are looking incredibly successful, but we have to go through a process. And it's going to be a fairly quick process, I will tell you, based on what the FDA told me. And another 15 are in plans for clinical trials. So they're advancing rapidly. And today, a second company announced that the FDA has authorized its vaccine candidate to begin clinical trials. So you have Johnson & Johnson is already there. I believe they're the one that's first. And now we have a second company that just announced, and was just approved. So we have two companies at that level for the vaccine itself. We've now performed 100, well, if you think of this, 1.79 million tests. That's 1,790,000 tests nationwide. And I think we're going to put up a screen here someplace. Good. They're on cue. They're just on cue. And here it is. This is the process starting on 5 March and ending right there, right about now, right? That's about it. Yesterday. So, and it's going up at a rapid rate. Nobody has done more testing. And one of the reasons why they say, and I think I can say this, Deborah, very strongly, but one of the reasons that we have more cases is we've done more testing. If I went to some of these countries that have, in my opinion, far more people than we do that had the problem, and if we did the kind of testing proportionally that we're doing, they'd have many more cases than us. But we have more cases because we do much more testing. So when you do the testing, you have cases. Otherwise, you wouldn't know about the cases. People sit home, you don't know about it. But we have now done 1,790,000 tests nationwide. That's more than any other country in the world. Hence, we have more cases. And that number is growing by nearly 125,000 people per day. Think of that one. So it's growing by 125,000 people per day. I told you about South Korea. This is a, vastly faster. And we also have, they say, the most accurate of tests. CVS is launching, and they've been great. 2 new drive-through testing sites in Atlanta, Georgia, and Providence, Rhode Island. And each location will be able to test up to 1,000 patients per day using the ultra-fast 5-minute test developed by Abbott Labs. Now they're down to 5 minutes. They call it the ultra-fast, and it's very accurate. Abbott Labs, I want to thank them. They've been fantastic. We're also speeding urgent economic relief to the American worker and families and the employers. As of today, tens of thousands of small businesses have applied for more than $40 billion in relief under the Paycheck Protection program. You've all been reading about it, and it's really, it's only been going for a couple of days. It's really been performing well. A couple of little glitches, minor glitches that have already been taken care of, what they say. These funds will result in nearly 2 million jobs being preserved, so we're taking care of our workers, small businesses and our workers. Nearly 3,000 lenders have already made loans under the program, and we're signing up additional lenders very quickly, rapidly. Community banks have been very responsive, and larger banks are also stepping up. If we run out of funds, by the way, we're already preparing because it's going so fast for the small businesses and their employees. We'll ask Congress to refill it immediately. But the banks have been great. The big banks, the Bank of America was right up there at the beginning. J.P. Morgan Chase has been great.
And good evening. This is Russ Mitchell from the WKYC studios. We've been watching the President of the United States give his daily coronavirus briefing. We're going to send this over to our website, WKYC.com, and our Facebook page, so we can bring you some news from Cleveland and beyond tonight. 3 News, What Matters Most, begins right now.
From the WKYC studios, this is What Matters Most.
Good evening to you. I'm Laura Queso, joining you once again from home tonight.
Good evening, Laura, and I'm Russ Mitchell from the WKYC studios. Let's begin with a look at the latest on the coronavirus tonight. British Prime Minister